I'm from a small town in southern Minnesota, Sherburne, and I went to school out in South Dakota, but always had a passion to come back to Minnesota and continue to do care here. All of my family is here, and just wanted to be close to them. I'm a family person. I guess nursing started for me with my grandparents. Both of them had quite a few hospital stays, clinic visits, and I started noticing that it wasn't the doctors really taking care of them and asking them how they were doing. It was the nurses, and that's what got me interested in what they do as a field and what their profession is, and from there I just knew that that's what I wanted to do. So when I started nursing, I started in home care as a case manager for kids who had complex needs and they needed nursing in the home. And my job was to make sure that nurses were available for them, that they were trained to do the things that they did. And then when I took the role at Mankato Clinic, it helped broaden that in seeing how the clinic helps case management in the home. And my job here now is to coordinate the care between the provider and those home care agencies. And then with that, I also screen the entire population and look for where we can do better as a clinic, where we can improve our diabetes care and our care for those complex needs kids, and also where we can help improve the population health as a whole for our kids. So when a patient comes into the clinic, they're identified by either the nurse, the provider, or myself as someone who could possibly benefit for care coordination. And so with some of the providers, I come in at the end, during the entire visit, or sometimes at the end of the visit, and I just talk about my role and how I might be able to help better serve them, whether it's getting them connected with community resources in the area or coordinating between our providers and outside providers, or it could be coordinating between a dozen different organizations, maybe a home care, our providers, outside providers, and what my role is. And then we talk about healthcare home in general and what the state or what healthcare home, what we're doing at a local level and at a state level, and how they can foresee their care being here and broadly. So healthcare home is a team collaboration between the provider, his nurse, and myself and the patients, or their patients and parents. And together we come up with what are their goals. Maybe not necessarily health goals that they can see right away, but goals that will help them either stay out of the hospital or help them at home with the things that they can do at home to keep them healthy. And we support, and then the providers and myself and the nurses along with the parents help support those goals. So the whole picture for the clinic is we will be expanding the care coordination role, and right now there's just the 3 of us. But it's exciting because we'll be able, especially in the pediatrics department, as a child grows, we'll be able to help transition from pediatric doctors to those family practice doctors. And with their care coordinators as well, they'll be able to make a nice handoff, and parents will feel have that support through the whole process, and there won't be any gaps that are left behind and questions left behind.